Modes of ventilator, which means the way that this ventilator work. كيف بيشتغل هذا الفنتليتر. The first mode is the controlled mandatory ventilation, CMV. The machine completely controls the patient ventilation according to set tidal volumes and respiratory rate. الفنتليتر هو المسؤول عن إعطاء المريض بشكل كامل التايدال فوليوم والريسبيراتوري ريت، والمريض لا يشارك بأي effort. The beep is often added, which is the positive end expiratory pressure that help keep the alveoli open and prevent the alveolar collapse. Patient efforts do not trigger a breath, so the rate set on a ventilator and CMV is also the maximum rate as well. كونه المريض ما بيشارك بأي effort، إذا احنا بنحط للمريض على جهاز التنفس الاصطناعي الريسبيراتوري ريت الذي يحتاجها. Sedation needed, paralytic agent needed. It is rarely used and usually used in apnea بحالات توقف التنفس. Assist controlled mode ACM. The patient trigger the machine, assist in initiation of each breath. If the patient fails to breathe, the machine will deliver controlled breath at minimum respiratory rate and preset tidal volume. إذن المريض يساعد الفنتليتر بعملية initiation of the breath، وإذا المريض فشل في أخذ هذا النفس the machine will deliver a controlled breath، سوف يعطي نفس كامل وعدد من التنفس و preset tidal volume. Useful for patient recovering from anesthesia، عملية الصحصحة من الأنستيزيا with especially for patient with weakened respiratory muscle. Synchronized intermittent mandatory ventilation SIMV. Both the tidal volume and the number of machine breath and FiO2 are also set on the ventilator, but they are only delivered intermittently بشكل متقطع alternating with the patient on breathing effort، متقطع ما بين النفس اللي راح ياخذه المريض منه لحاله. إذا هون المريض is able to take a breath، لكن برضو جهاز التنفس الاصطناعي راح يعطيه preset determined tidal volume and respiratory rate. Between the ventilator, intermittent mandatory breath, the patient breathes spontaneously, setting his own tidal or her own tidal volume and respiratory rate. Beep is often added and used for short-term weaning. CPAP, which is the continuous positive airway pressure, providing positive pressure to prevent alveolar collapse, and also used for weaning process to increase the respiratory muscle strength. It is the final step before extubation. Respiratory rate and tidal volume is generated by the patient. Maintain constant positive pressure in the airway so that the resistance is decreased. By providing this positive pressure, the resistance decreased. Assist spontaneously breathing patient to improve their oxygenation by elevating the end expiratory pressure in the lung. This mode, called inverse ratio ventilation, I to E ratio, is reversed to allow longer inspiration. عادة احنا بنعرف ان الاكسبيريشن هو اطول من الانسبيريشن. In this mode نعمل reversing بحيث انه احنا نطول فترة الانسبيريشن to provide more oxygenation. E time is shortened to prevent alveolar collapse, and positive end expiratory pressure added also to prevent alveolar collapse. Need sedation, only used with mandatory ventilation. This will improve the oxygenation, especially for patient who is hypoxic. Among patients with acute respiratory distress syndrome, and this disease will be explained later. Non-invasive positive pressure ventilation. Positive pressure ventilation is provided through fitting mask ماسك كويس بالوجه. No need for intubation. And this non-invasive positive pressure used to treat sleep apnea and also used for weaning to prevent or no need for intubation. Complication discomfort from the fitting mask, gastric distension and self-removal المريض بيقدر يشيله لحاله. It's used to overcome some of the complications of the endotracheal tube. هذا non-invasive pressure, positive pressure. لكن contraindication إذا كان المريض hemodynamic unstable and unable to clear the secretion and patient who is uncooperative. The pressure support which augment or assist يساعد the spontaneous breathe with the preset inspiratory pressure بحيث انه احنا بنعطي pressure support يدعم دخول الهواء الى المريض. Tidal volume varies according to the patient effort, can be used alone or in conjunction with SIMV. It's used as a mode for long-term gentle weaning. PEEP, which is positive and expiratory pressure, a positive pressure that applied at the end of expiration, used with different mode like CMV, assist control, SIMV to improve oxygenation by opening the collapsed alveoli or to prevent the alveolar collapse. This will help, or this mode will help hold the alveoli open by keeping pressure higher than atmospheric pressure. It's started at 2 to 5 centimeter or millimeter mercury and increased to attain a saturation of more than 90% أو ال PaO2 يكون أكثر من 60. في بعض الحالات طبعا هذا البي بيوصل إلى 20 ملم مركوري، ممكن نزيده ل 5 10 ل 20 ملم مركوري. وأيضا ممكن نحط هاي بي بحالات acute respiratory distress syndrome that will be explained later. The PEEP complication. There are significant complications for PEEP with no adequate circulation especially وخصوصا إذا كان المريض السيركوليشن عنده قليلة أو low circulating blood volume. The PEEP will decrease the venous return to the heart that may result in hypotension, decreasing the cardiac output and decreasing the oxygen delivered to the tissues. In case of hypotension, we can provide the patient with IV fluid. Also, with increased PEEP, especially if the PEEP increase up to more than 10 to 20 millimeter mercury, power trauma may induce the high pressure and low lung compliance, and at this time may we need chest tube. Power trauma damage to the tissues نتيجة الهاي PEEP. High pressure alarm may result from the presence of secretion in the airways or the endotracheal tube, neck in the tube, انثناء, patient biting the endotracheal tube, المريض عض على endotracheal tube, coughing, gagging, trying to talk, كلها بيزيد من ال pressure inside وبالتالي high pressure alarm, increased airway pressure because of bronchospasm or pneumothorax. low pressure alarm يعني جهاز التنفس الاصطناعي راح يعطي alarm بس بكون low pressure نتيجة انه الفنتليتر تيوب not connected، صار في فصل ما بين التيوب اللي خارج من الفنتليتر مع الاندوتراكيال تيوب. displacing endotracheal tube أو tracheostomy tube، تغيير في مكانه. high respiratory rate, the patient anxious or in pain. secretion in endotracheal tube. hypercapnia زيادة ال CO2. patient fighting ventilator. low exhaled volume نتيجة انه there is a leak in the cuff or the ventilator tube not connected.